Heart disease is often called the silent killer, not because it moves in the shadows with malice or suddenness, but because it works quietly, almost imperceptibly, striking without warning and often in those who least suspect it. Every year, millions of individuals, confident in their well-being, follow their routines, working, exercising, caring for their families, unaware of the invisible risks building within their arteries. It's a sobering reality. Even people who appear in peak physical health, who run marathons or carefully monitor every bite of food, may still be at risk. The truth is more complex than eat well, exercise, and you'll be fine. It's time to look deeper and understand what heart disease really is, why it matters for everyone, even the fit and healthy, and what practical steps you can take to protect yourself and those you love. Let's begin by understanding the scope of coronary artery disease, commonly referred to as CAD. This is a condition where the arteries supplying blood to your heart muscle become narrowed or blocked due to the buildup of fatty deposits called plaque. When this plaque hardens, it can form calcium deposits, further limiting blood flow. Over time, this buildup affects how efficiently the heart receives oxygen-rich blood, increasing the risk of serious problems like heart attacks, arrhythmias, and, sadly, sudden cardiac death. What many people don't realize is how common silent CAD can be, especially in middle-aged adults who consider themselves otherwise healthy. You might ask, if I feel great and am active, how could my heart be at risk? It's a fair question, and the answer lies in the subtleties of how heart disease develops. In fact, research tells us that 80% of sudden cardiac deaths among middle-aged athletes, the group you might expect to be safest, can be traced back to undiagnosed coronary artery disease. For a significant number of these individuals, their sudden event wasn't preceded by any symptoms at all. Their first warning was their only warning. But why does heart disease remain so invisible for so many, even among the health-conscious? Part of the reason is that coronary arteries can gradually narrow over years or even decades. The heart is a remarkably resilient organ with collateral blood flow, so symptoms like chest pain or shortness of breath often don't show up until a major blockage occurs or a piece of plaque ruptures and causes a clot, cutting off blood supply abruptly. It's easy, then, to misinterpret occasional fatigue or minor aches as just part of aging or training, rather than a symptom demanding attention. This doesn't mean you should panic or live in constant fear, but it does highlight the need to assess your personal risk with as much honesty and objectivity as possible. Knowing your risk allows you to make evidence-informed decisions about your health, possibly preventing tragedy and giving you greater control over your future. One of the advances in heart disease assessment in recent years is the use of non-invasive imaging to get a clearer picture of what's happening inside the arteries. Among these, the coronary artery calcium scan, frequently performed by a CT scanner, stands out. Here's how it works. A CT scan of the heart can detect and measure the presence of calcium deposits within the walls of the coronary arteries. The result is a calcium score, a number that estimates the amount of hardened plaque in the arteries. Why is this important? Because calcified plaque is a marker of atherosclerosis, the process underpinning coronary artery disease. The higher your calcium score, the greater your odds of having significant coronary artery disease. In fact, a score of 0 is considered the lowest risk category, and higher scores correlate with progressively higher risk. However, the calcium scan isn't perfect. It has its limitations. While calcium buildup indicates more advanced, potentially more stable plaques, these scans don't identify the softer, earlier stage plaques, those fatty, non-calcified deposits that can still rupture and cause a heart attack. So, a clean score doesn't mean a completely clean bill of health, nor does a high score guarantee trouble ahead. Still, it's a valuable tool in the arsenal of prevention. What's notable is the increasing popularity of these scans among middle-aged athletes, men and women who have often spent decades looking after their physical health, yet who want an extra layer of assurance about their heart health. Many turn to calcium scans after hearing about cases where fit friends suffered heart attacks without warning. They want to know, could this happen to me? Let's pause for a moment and consider the story of John. a fictional but representative figure drawn from countless real-life cases. At 55, John has run over a dozen marathons, actively tracks his diet and cholesterol, and never smoked a day in his life. Yet, after reading about a sudden cardiac death in his running group, he opts for a cardiac calcium scan. To his surprise, the report comes back with a calcium score indicating significant plaque buildup. He's stunned. How could this be when he's done everything right? Turns out, John isn't alone. Beneath his dedicated routine lurked risk factors. A family history. His father died of a heart attack at 60, and he'd had borderline high cholesterol most of his adult life. These are ingredients, alongside age and male sex, that increase the likelihood of coronary artery disease, even in the religiously healthy. John's story underscores a crucial point. Even regular exercise and healthy eating provide no absolute guarantee against heart disease. Genetics, age, and certain life events can still play a decisive role. But knowledge is power, and for John, the scan became a call to action rather than a sentence. He consulted his doctor, underwent further tests, and together they built a forward-looking plan to reduce his risk. For many, especially in places like the UK, the process starts not with imaging, but with a risk calculator, a mathematical tool designed to estimate your probability of developing heart disease in the next 10 years. One such tool is the Q-Risk Calculator, which incorporates key factors like age, sex, blood pressure, cholesterol, smoking status, diabetes, ethnicity, family history, and other health conditions. The Q-Risk score delivers a percentage, say 10%. That means based on people with your risk profile, you have a 1 in 10 chance of experiencing a heart event over the next decade. This estimate doesn't guarantee what will happen to you personally, but it's an essential guidepost. For someone like John, reviewing his Q-Risk prompted a more informed, collaborative discussion with his physician about which steps to take next.
So, what happens when your Q-Risk, or calcium score, suggests a higher risk? One well-known decision point is whether to start taking medication, such as statins. Statins are drugs that help reduce LDL cholesterol, one of the major contributors to atherosclerosis and plaque formation. Statin therapy is carefully considered, not just automatically prescribed. The evidence behind statins is robust. Among high-risk individuals, statin use has been shown to lower the chance of major cardiac events by about 25%. On the face of it, that sounds like a remarkable benefit. If you're at 10% risk, your risk drops to about 7.5%. In population health, this is a tremendous reduction, potentially saving millions of lives. However, on an individual level, the calculus is more nuanced. For someone who is otherwise low risk but has a slightly elevated cholesterol, the benefit may be marginal. And like all medications, statins have potential side effects. Muscle aches, headaches, digestive troubles, and rarely more serious issues such as liver injury or increased risk of diabetes. For many, statins are well tolerated and life-extending, but they are not entirely free of downsides. This is why the decision to start medication must be personalized, carefully weighing risks and benefits in discussion with your healthcare provider. Dr. Peter Clarkson, a cardiovascular expert and an avid rock climber himself, underscores this point in his conversations with patients. He explains that for those at modest risk, say a calculated 5 to 10% chance over 10 years, the difference made by a statin, while real, may not be worth the inconvenience or side effects for everyone. Far more important are the lifestyle measures people can take: reducing blood pressure, maintaining a healthy body weight, moderating alcohol, and, of course, exercising regularly. One might ask, given all this, does the discovery of coronary artery disease or a high calcium score mean you should hang up your running shoes or gym bag? Quite the opposite. Decades of research confirms the profound, irreplaceable benefit of regular physical activity for heart health. Exercise is itself one of the most powerful tools available to lower cardiovascular risk, both for prevention and after diagnosis. Multiple studies have compared the outcomes of active individuals with high calcium scores to inactive counterparts with similar risk profiles.
The results are clear and compelling. Active people, even with some degree of coronary artery disease, tend to fare much better than those who are inactive. Fitness doesn't eliminate risk entirely, but it shifts the odds firmly in your favor. The specific mechanisms are fascinating and multifaceted. Exercise helps keep blood vessels flexible, enhances collateral blood flow, improves cholesterol profiles by raising HDL, lowers blood pressure, reduces inflammation throughout the body, and increases insulin sensitivity. All factors that work together to support heart health and reduce the likelihood of a plaque rupture or heart attack. Importantly, exercise also improves the function of the endothelium, the inner lining of blood vessels, and stimulates the development of new, tiny blood vessels, called collateral circulation, that can act as natural bypasses if a blockage forms. It's a remarkable demonstration of the body's capacity to adapt and protect itself. If you're a seasoned exerciser or a beginner just starting, whether your goal is to run marathons or simply to walk more each day, movement should remain part of your toolkit for a long, healthy life. In fact, studies suggest that among people with coronary artery calcification, those who are physically fit have a risk of cardiac events that is up to 50% lower than their unfit peers. But what kind of exercise is best? For heart health, both aerobic activities, like brisk walking, cycling, swimming, and running, and strength training have important roles. Aerobic exercise, in particular, tends to have the most research-backed benefits for reducing heart disease risk. But resistance training also contributes by improving blood sugar control, helping with weight management, and maintaining muscle mass, which is critical as we age. The key, experts say, is regularity and variety. Consistency, doing something almost every day, is more important than intensity or duration. Even modest amounts of activity add up and deliver real benefits. As the familiar adage goes, the best exercise is the one you actually do. Find activities you enjoy, mix them up, and keep moving. At this point, you may be wondering, aside from medication and exercise, what other changes can you make to lower your risk? The good news is that many steps are within reach for most people. Here are some proven strategies.
Maintain a healthy weight. Carrying extra pounds, especially around the waist, raises blood pressure, worsens cholesterol levels, and increases the risk of diabetes, all contributors to heart disease.
Eat a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats like olive oil and nuts. Minimize ultra-processed foods, added sugars, and excessive salt. Manage blood pressure by checking it regularly and working with your healthcare team to keep it in a healthy range, ideally below 120/80 mmHg for most adults. Watch your cholesterol numbers and aim for heart-healthy levels, particularly LDL, bad cholesterol, and triglycerides. If you smoke, take all necessary steps to quit. Smoking is a major, completely preventable contributor to CAD, damaging blood vessels and accelerating plaque buildup. Limit alcohol consumption, ideally to no more than 1 drink per day for women and 2 for men. Move regularly. Aim for at least 150 minutes of moderate-intensity aerobic physical activity or 75 minutes of vigorous activity per week, plus muscle-strengthening exercises. Get enough sleep, 7 to 8 hours per night, which is increasingly recognized as a critical factor in overall heart health. Manage stress proactively. Techniques like mindfulness meditation, yoga, hobbies, or social engagement can all help offset the effects of chronic stress. Finally, keep up with regular checkups and talk openly with your doctor about your risk factors and concerns. The most dangerous heart conditions are often those that go unnoticed and untreated. If you have a family history of early heart disease, you may need to be especially vigilant. Early generally means under 55 for men and under 65 for women in your immediate family. Let your provider know, and don't hesitate to ask about your need for extra screening. To bring this all together, remember, protecting your heart is not about fear or restriction, it's about empowerment. The tools to understand, assess, and lower your risk are more available now than ever before. If you are middle-aged, even if you look and feel great, take the simple steps to assess your individual risk. It may mean using a risk calculator like QRisk having a cholesterol test, or speaking with your doctor about whether a calcium scan is right for you.
If, after assessment, your risk is elevated, discuss your options thoroughly. Be it medication like statins, increasing your activity, refining your diet, or integrating other lifestyle adjustments. Each measure builds upon the others, and together they add years to your life and life to your years.
Never neglect the value of exercise. Keep moving, find joy in movement, and let physical activity remain a core part of your routine. That's true whether you're trying to ward off trouble before it starts, or manage a condition you've already discovered. The evidence is so overwhelming that health professionals around the globe universally recommend regular movement as a cornerstone of heart health. If you're worried about the risks of exercising with known heart disease, remember that the vast majority of people benefit from being active, even after a diagnosis. Still, check with your doctor before starting a new program, especially if you have symptoms or a high calcium score. Follow their advice, go at your own pace, and listen to your body. John's story, and those of so many others, shines a light on the importance of awareness, early assessment, and proactive intervention. He could have remained unaware, believing his fitness made him invincible. Instead, his diagnosis became the start of a new chapter focused on vigilance, continued movement, and sensible choices, a model for anyone seeking a long, healthy life. As we close, reflect on your own habits, family history, and health status. Take a few moments today to think about your lifestyle and consider discussing your cardiovascular risk with a trusted healthcare professional. Encourage your loved ones to do the same. Remember, heart disease is not only a personal risk, but a family and community concern. The healthier you are, the more you can contribute, support, and inspire those around you. Perhaps most importantly, don't let worry paralyze you. Let it motivate you. With knowledge comes the power to act, and every positive step counts. Assess your risk. Make informed decisions. Prioritize movement. Eat thoughtfully, and support others in doing the same. If you found this information useful, help us spread the word. Sharing this knowledge could mean the difference for someone close to you, perhaps even saving a life. Like, share, and subscribe for more insights and practical tools for staying healthy, vibrant, and heart-strong. In the journey to lifelong wellness, the heart matters most. Take care of yours, and live each day to the fullest. Stay active, stay informed, and keep your heart healthy.